Hello, Mark Benefiel, Senior Healthcare Advisor and Partner here at Market Medicare Advisors. I'm super excited to have you join us today for this Medicare 101 webinar. Hopefully by the end of this session, you'll have a number of your questions answered and you'll be in a perfect position to start your Medicare journey with a consistent amount of information and feeling confident about what your next steps are. We're going to start out today talking a little bit about original Medicare, Medicare Part A and Medicare Part B. Typically, when you've had insurance over the last, 15, 20, 30 years, you probably had a employer-sponsored plan that had all of your insurance needs all wrapped up together into one nice little ball. You had a card, typically had a PPO organization or an HMO organization, and when you used that card, you went to the doctors or you went to the hospital, you went to the pharmacy. It was all kind of wrapped up in a nice little ball. However, original Medicare kind of takes a little bit different approach. It breaks down the different parts and pieces, and that's what we're really going to focus on at the beginning of our webinar today. First, we're going to talk about Part A. Part A commonly is known as hospital insurance or hospital coverage, and typically it covers your stay while you're in the hospital. The standard monthly premium is $0. However, you could have a premium if yourself or if you have some spousal benefits and that spouse did not contribute to Medicare for at least 40 quarters. So typically there's no premium, but you could have a premium depending on how many quarters were worked or if enough of them have not been worked. Then we have what we call our Part B insurance, our doctor's coverage. Typically the monthly premium for 2025 is $185. However, depending on your income level, it could range up to as much as $628.90, like I said, depending on your income. Most people are going to pay that $185. However, there could be some opportunities for you to contribute more based on an income adjustment, which we will cover just a little bit later in the session. So original Medicare, Part A and Part B. If you're currently receiving Social Security benefits, so let's just say you're getting ready to turn 65, and it's typically when people will find us on the internet and find our webinars. When you're getting ready to turn 65, if you've already enrolled in Social Security, say you started when you were 62, then you will automatically be enrolled in Social Security at that time. And that premium will be taken directly from your Social Security payments. You'll also probably receive your ID card sometime a couple of months to 3 months earlier than your actual birthday begins. So you're going to start this process. If you're already on Social Security, then you'll be enrolled automatically, like I just mentioned. Your payments would take out of your Social Security check every month. And then also you could receive your ID card just a couple of months prior to your actual birthday. If you do not currently receive Social Security benefits and you need to enroll, so let's say you're getting ready to turn 65 when you're first eligible, you would have to enroll if you're not already on Social Security. And the way you do that, as you see here on the screen, you must manually do so. In my opinion, the easiest way to do that is to go online to, you see the website address there, go online and go ahead and enroll online. You can also, if you don't have access to a computer or prefer, you can call. You see the phone number there to call, or you could go into the Social Security office or even mail an application into Social Security. One thing to keep in mind if you're enrolling manually is that the Part B premium is billed on a quarterly basis, so be ready for that expense when it first comes through. Original Medicare enrollment, Part A and Part B. One thing you need to keep in mind is that your coverage typically will begin on the first day of your birth month. So don't be confused. Say, for instance, my birthday is in May. It's actually May 21st. If I was going on Social Security, then the first day of the month or the 1st of May would be my first day that I would be eligible for Medicare. Typically, private insurance will end on the last day of the month, and your Medicare insurance will begin on the beginning of the month. So we try to measure those two together. So be aware of when your insurance ends and when Medicare is going to begin, so there's no gaps in coverage. So what if you're still working and you're covered by an employer plan? You have a couple of choices. You can choose to enroll in Medicare effective on your 65th birthday, or you can delay Part B of Medicare until you retire and you decide to get a Part B plan at that point. So what is this Part B penalty that I speak of, this late enrollment penalty? Well, a Part B penalty is assessed if you do not enroll in Part B either during your initial enrollment period, that 7 months surrounding your birthday, or if you fail to enroll during your special enrollment period, if you defer enrollment at 65 and elect to continue working, or are covered by a spouse's credible insurance plan. And at that point, when you finally do retire completely or do come off your spouse's plan, you then have a period of 8 months in which you can enroll. If you fail to enroll during one of those initial enrollment period or that special enrollment period after you finally do decide to retire or come off your spouse's plan, then Medicare Part B penalty is a 10% premium increase for each 12-month period in which you delay your Part B enrollment. However, for you guys watching this webinar today, you're not going to have to worry about that because you're going to sign up during that that 7-month period around your birthday, or if you elect to continue to work, when you finally do retire or come off that spouse's credible insurance plan, you then have 8 months at that point. So you're not going to have any penalties because you're going to follow those rules. So let's talk a little bit about some of the major exposures with Medicare. A lot of people come to our office and they think that Medicare doesn't cost them anything, and very quickly they realize and they find out that's not necessarily the case. And so let's talk about some of the costs and some of the major exposures that we have to deal with Medicare. As we mentioned earlier, Part A doesn't typically have a premium, although it could if you have not worked the 40 quarters that are necessary to have a premium-free Part A hospital coverage. But one thing we need to remember and keep in mind is that we do have a $1,676 deductible for each benefit period. And the reason why I say each benefit period is because it's not a true annual deductible. You could have multiple deductibles throughout the year if you have different benefit periods or had to find yourself in the hospital for unrelated conditions on more than one basis throughout the year. So you could have some additional deductibles to deal with. Part B coverage does come with some expenses as well and some exposures that we need to make sure that we cover in today's session. First of all, you do have a deductible. This is a true calendar year annual deductible of $257. You also have a co-insurance that you need to be aware of and be responsible for. That original Medicare is an 80-20 co-insurance, meaning Medicare is going to pay 80% and then you're responsible for the other 20%. The problem with that is, even though 20% doesn't sound too bad, there's actually no maximum out-of-pocket limit when you're dealing specifically with Part B coverage. And that could get very, very, very expensive for you. Last year, my family had an event where they had a rare diagnosis with a lot of hospital time and a lot of rehab, and the bill was in the hundreds of thousands of dollars. And if you had a similar event and you had to pay that 20%, that could cost you quite a bit of money over time. So not only do you have to deal with the deductible of $257 per calendar year, you have that 20% co-insurance, but there is also a Part B excess charge where a doctor could charge you up to 15% more than what Medicare pays and can pass that cost along to you. So because we have these major exposures, because we have these gaps in coverage, because we have these deductibles we have to deal with in the co-insurance and the excess charges, we have to find a way to cover those gaps, those exposures, if you will. So a good amount of the rest of our seminar is going to be talking about how we're going to mitigate that risk, how we're going to limit that exposure by looking at a couple of different ways. One would be through a Medicare supplement. The other might be through a Medicare Advantage program. We're going to look at both of those here for the bulk of the rest of our time with our seminar. So on your screen right now, you're going to see two paths to coverage. You're going to see original Medicare on the left, which we've been talking about so far, Part A and Part B. We're also going to talk a little bit about Part D, the prescription drug coverage. And then we're also going to talk a little bit about Medicare, Part C and Part D, as both of those are combined together, and we'll give you a little bit better insight into both of those in just a moment. So when we talk about the two paths, what we're really talking about, how do we mitigate, how do we handle that risk, that exposure of all those additional costs, that $1,676 Part A deductible, the 20% co-insurance, the excess charges. One of the ways that people look at when they're trying to decide which is the best way for them to mitigate that expense is through a Medicare supplement. The other way is through Medicare Advantage. And Advantage is a program that is a standalone program that actually combines Part A, Part D, and also includes some additional items in that, usually some over-the-counter benefits as well, membership in some wellness programs like gym memberships, things like that, additional coverages including health, dental, vision, hearing are all wrapped up in here in some cases, in some of those plans. One of the things you'll notice as I look at Original Medicare, you'll notice that it does not include dental, vision, or health. Oftentimes they do have those wrapped up in an Advantage program, which a lot of people prefer that direction as opposed to going out and looking at some of those other options on from a personal basis. So we're going to look at both Original Medicare and Medicare Advantage here for the next few slides of the next few minutes of our webinar. So let's compare the two options, a Medicare Supplement to a Medicare Advantage program. A Medicare Supplement typically has some of the lowest out-of-pocket expenses when you see doctors and hospitals because typically there's no co-pays. Oftentimes Medicare Advantage, there are co-pays that go along with that, but when we have a Medicare Supplement, often we don't have co-pays at all there. There are some supplements that do include that, and we'll address that in just a moment. Price, Part B, when you have your Medicare Supplement, you're going to be paying your Part B premium, plus you're going to be paying the cost of the supplement premium as well. So you're going to have two costs that are involved there. You're going to, when you have a Medicare Supplement, typically you're doing that without any type of network. That's one thing a lot of people like about Medicare Supplements is they don't have a network. As long as a doctor that you choose participates and is contracted with Medicare in the United States, then you typically are not going to have a referral. You could have more than one doctor. You could have some specialists. You could even have a doctor in one area of the country, maybe even another area of the country if you do a lot of travel. And typically those are not, there's no referrals needed for that. You do, however, have to have a Part D prescription drug plan in place as well, what we call standalone prescription drug plan. And they're not always, but typically there is a premium associated with Part D. So you really have three premiums that you're going to have to take under consideration when you have Original Medicare. You're going to have your Part B premium, you're going to have your supplement premium, and then of course you're going to have a Part D premium as well. We'll give you a little bit of insight as to kind of some of those average costs before we're done with the webinar today, but just keep in mind you are going to have multiple premiums. If we look at Medicare Advantage, typically Medicare Advantage comes with a little bit of higher out-of-pocket costs when you see the doctor in the hospital, because typically you're going to have co-pays for most of the services that you receive, whether it be visiting a doctor or maybe lab tests, x-rays, whatever that might be. Part B premium typically can be very, very low cost, or there could be some larger costs, and we figure that out by basically the zip code that you live in, which program you specifically are most interested, what combination of benefits. Some of those do come with a very low or even sometimes no premium, but sometimes there could be a premium as well. Keep in mind that when you're on Medicare Advantage, everybody has to pay the Part B premium. Whether you're on Medicare Supplement, you have to pay Part B, or you have a Medicare Advantage Part B. But typically, there's no additional supplemental premium that goes along with Part B, or pardon me, with Medicare Advantage. You just have your Part B premium. There could be a premium, like I said earlier, for the Advantage plan, but not always. And you would really want to sit down with somebody or do your research to make sure you understand what those premiums are going forward. Typically, a Medicare Advantage program does come with a network. And so the doctors that you choose to see are contracted with specific companies and specific networks. And typically, if you want to go from one doctor to another, or from a primary care physician to a specialist, you're going to need a referral to do so. Oftentimes, Part D prescription drug plan is included, as I said earlier, in an Advantage plan. So typically you will not have an additional premium for that. There are some Medicare Advantage programs that do not include, under certain circumstances, Part D, but you're going to want to make sure you ask those questions, that if your Medicare Advantage plan that you choose includes Part D or does not include Part D. So let's look for now at the Medicare Supplement option. So as I mentioned earlier, if you choose a Medicare Supplement with Original Medicare, you're going to have Original Medicare Part A hospital coverage. You're going to have Part B medical coverage, plus you would add the supplement, plus you would need the prescription drug plan, as I just mentioned earlier. You would have to have all three of those to be compliant and to make sure you wouldn't have any types of penalties or any types of concerns moving forward. So let's just talk about this Medicare supplement. Sometimes you'll hear the term Medigap. We typically in our industry don't use the term Medigap a lot. You will see the term Medicare supplement. The reason why Medigap even exists is when we're talking about those gaps in coverage. Once again, that $1,676 Part A deductible, the 20% co-insurance, the possible excess charges. Those gaps in coverage are often filled up by a Medicare supplement. That's what we're really trying to do. We're trying to diminish our out-of-pocket expenses through deductibles and co-insurance and co-pays by paying a once-a-month monthly premium. Okay, so what are some of those major exposures, like we mentioned before, that we're trying to cover up? Remember, what we're doing is we're trying to, and I know I'm repeating this, but I'm repeating it for a reason. What we're trying to do when we choose that Medicare supplement or we choose an Advantage plan, what we're trying to do is cover those exposures, trying to make sure that you don't get caught with additional costs that you are going to be unexpected or are going to really hurt your budget or your financial situation going forward. Both paths can help mitigate those expenses, although they're not 100% necessary. You could, if you chose, just have Part A, Part B, and Part D, and you don't have to have anything else. Of course, if you do open yourself up to a number of exposures like we've been talking about. But if you choose a Medicare supplement, you can mitigate that by a once-a-month monthly premium, or you could decide to go with a Medicare Advantage program, of course, that would also mitigate those expenses as well by engaging in that program and paying your cost of your coverage up to your maximum out-of-pocket expenses through your co-pays and your co-share costs that you would have. Let's talk about Medicare supplements in general. You're gonna come across all types of supplements. You see A, B, C, D, F, G, K, L, M, N. There's lots of different supplements, and they pay lots of different combinations of things. We're going to help you out. We're going to talk about two specific supplements here in just a moment, a Plan G and a Plan N, because those are typically our most popular ones that we arrange for our clients. Those are not the only ones, but that's where we're going to spend a little bit of our time today going over those. So key points to understand about Medicare supplements. So when is the best time to enroll in a supplement? The best time to enroll in a supplement is basically about 6 months prior to your actual birth month. Why? Because you're going to get the cheapest rates. You're going to avoid any type of mistakes through the application process that may need to be corrected later and take a little time. And quite frankly, you just check that off your list. Once you check that off your list, you can then go forward into your last days of retirement. And as we say in our office, we would love to have you spend more time worrying about what flavor cake you're going to have at your party than having to worry about whether or not your supplement's going to get started on time. So just take that off, get rid of that stress, take care of it within that first 6 month period, and we still set that up to start the day that your Medicare would begin. But you can fill out that paperwork and get started and make all the arrangements at least up to 6 months prior to, if you choose to do so. Supplements are federally regulated, right? So that chart that I had a moment ago had all those different plans on there. Let's just say that you chose a Plan G. So keep in mind that the plans are regulated, but they're not necessarily all exactly the same on how they're administered. So let's just give you an example of that. So let's say you chose a Plan G, and say we represent a number of companies as an independent broker. Say I represent, 20 different supplement companies right now. Not all in every supplement company, but a lot of them. And let's just say we are looking at a Plan G. If I took all 20 of those, CEOs, aligned them out here, and I said, please explain to me your Plan G, you're going to find that each one of those Plan Gs are identical because the program demands that they be identical. How they're not identical, however, is necessarily in cost and, quite frankly, in customer service. How well they're administered. Do they take care of problems? Do they not take care of problems if there is an issue? So if you're getting those phone calls, if you're getting those letters, if you're getting those postcards at your house, and there's people telling you that their plan, whatever, Plan G or Plan N is better than another company's Plan G or Plan N, they're not being truthful with you because those plans are the same. They could make an argument their company, The way they administer it, maybe their pricing is superior, maybe their customer service is superior, but the plan itself is identical. So don't fall into that trap of thinking this one company's plan N has different coverages than another company's plan N, or a company's plan G has different coverages than another company's plan G, because they have the same coverages across the board. So what is the cost of a plan G? Average cost, average rates are going to, depending on where you live in the country, where you might be seeing this from, it could be a little bit more, less than this, could be a little bit more than this, somewhere between $100 and $200 a month, depending on which zip code that you live in, what age you are when you decide to purchase a supplement plan, whether you smoke or not, whether you're male, whether you're female. Those are really the only items that they're going to utilize during the initial coverages, initial time frames of getting your plan G during that first year of initial coverage. During that first year of initial coverage, whether you enroll during your initial enrollment period or your special enrollment period, if you decide to continue to work, you have a guarantee issue period. And during that guaranteed issue period, the supplement companies must offer you and approve a supplement based on your current health condition. However, after that period, right, after that period of time, if you then went back to them and decided, hey, I want a supplement now, say 2 years down the road or 3 years down the road, each individual company has their own individual underwriting criteria that you would have to make it through and be eligible for. So you have a guaranteed issue period at the beginning of your term, whether you're first turning 65 or if you've delayed that, and your special enrollment period for when you come off your employer's or spouse's insurance. After that period of time, however, you would be responsible for going through an underwriting process. So choose wisely as you go forward and make sure you're making good, solid decisions based on your health. Here's just a quick list of some of the Medicare supplement companies that we work with. Like I said, we don't cover all of them, but we do cover a lot of them. So, a lot of people ask me questions, and one of the myths that we hear a lot, or a question that comes a lot, is that people would have to pay more if they use us, a broker, an independent broker, than if they, for our help. Do we have to pay more for you versus if we went to a company directly? Well, the reality is we don't charge any fees of any kind for our services, right? We, regardless of if you consult with us, whether you watch this webinar, we see it as an educational event, whether if you decided to give us a call at some point or inquire by email, or if you would ever sit down with us in person or by a video call or by a phone call, at no time is there ever any charge for our specific fees at Market Medicare Advisors. Well, the next question then comes up is, well, Mark, nobody works for free. So the insurance company must charge you more or a higher price if they go through a broker like us. Well, that's not really true either, because you will pay the exact same amount whether you use a broker to help you or if you decide to go it alone and go to the insurance companies directly. If you don't learn anything else from this webinar today, I hope you walk away with this one piece of information. If you're going to go onto Medicare, my suggestion would be that you find an independent Medicare insurance brokers, just like myself. There's many other companies that are out there that do a good job. You could go it alone, and you could make good, solid decisions. However, you're going to find life a lot easier if you're working with somebody who's educated and understands the process, can help you walk through and understand the different parts and pieces as we go forward. So you've done a good job of being on the webinar today, but don't that be your only interaction. Find a good, solid broker who can help you walk you through this process. Is it possible to do it? Yes. Do I spend a lot of time in my office every single week correcting mistakes that people did when they went out on their own? Yes, I do. And I'd hate that to be you as well. Another myth. If you get paid by the insurance company, you must be biased towards one company or another company. Well, the reality is we don't represent every company, like I said earlier, or all the plans that are out there, but we do have access to over 20 different companies, and we get paid by whichever one that you choose, the ones that you decide. We aren't biased in any way towards one company or another, and we want to keep it that way. So just to summarize real quickly, number one, we don't charge any fees for what we do. Number two, The price you pay for the insurance company is the same with or without a broker. And truth number 3 is that with over 25 companies to choose from, we simply are not biased on which companies we ultimately work with you and when you make the decision on which company to go forward. So let's talk about those 2 supplements we talked about earlier. We had, like I said, there were lots of different ones. We don't have time to go through all of them, but 2 of our most popular ones are our Plan G and our Plan N. So say you decide to go with the Plan G. You're going to have 2 expenses you're going to have to be responsible for. You got to remember is one, you're going to have your $185 Part B deductible. Beyond that, you're going to have to pay your Plan G premium, which, as we mentioned earlier, is somewhere between a little bit less maybe than $100, a little bit more than $200, depending on your zip code, your age, et cetera. And what is that going to pay for? When you pay your Part B deductible, your Part B premium, and your Plan G premium, what exactly does that pay for? Well, the cost that you have be responsible for would be $257, which is the Part B deductible, right, for the calendar year in 2025. And you notice there's an asterisk here. And the reason why is that's as long as you're accessing services from a Medicare participating provider. So you need to make sure you ask that question before you go to a doctor or specialist. Do they accept Medicare, and are they accepting patients, Medicare patients? Make sure you ask both of those questions. So you're responsible for that $257 as long as that care that you're getting is from a Medicare participating provider. You shouldn't have usually much, if any, other additional costs throughout the year. Once you pay your premiums, you pay that $257, and then the supplement company will pick up the charges after that. So Plan N. Plan N is another popular one. It typically costs somewhere between $20 to $25 less than a Plan G in the area that you live. And there are some costs you have to be aware of if you go with the Plan N. First of all, you still have your $185 Part B premium. You have your cost of your premium for your Plan N. You have your $257 deductible for your calendar year 2025. Once again, as long as those services are being accessed from a Medicare participating provider. However, there are a couple of copays that are associated with Plan N. You have a $20 copay each doctor's visit, and you could have a $50 copay for each ER visit that's not when you are not admitted to the hospital after ER visit. Also, it does not cover the Part B excess charges. So you can save a little bit of money on a monthly basis, but there are some other dollar figures that you need to make sure you're aware of if you decide to go with Plan N. Plan G, Plan N, one of the other plans are all could take care of various different costs, and you can sit down with an advisor such as myself or a broker. It could kind of look at all those costs and find out which plan is best for you. Or you could, like we said earlier, go out and do that on your own. If you choose to, you certainly could do that, but we'd love to be able to help you if we ever had the opportunity. Original Medicare. So far, we've been talking about Part A, Part B. We've been talking about supplements and Advantage plans. However, what we haven't really talked about yet is the prescription drug plans. Now, keep in mind, a prescription drug plan, if you go with Original Medicare, you have to have Part A, Part B, and you have to have Part D. And we mentioned earlier, if we don't have Part D, we could also have some penalties that are associated with Part D as well. So keep in mind that Part D drug plan is a private insurance company that offer these plans. And you have to enroll in a standalone plan in order to obtain coverage. It doesn't come automatically like some people think with Part B. It's a separate section, a separate plan that you need to make sure that you invest in. And so how do we decide which is the best plan and what are the different parts of that plan? Well, there's 3 different stages they have to be aware of when you look at a prescription drug plan. The first, what we call the deductible stage. Every one of our prescription drug plans comes with a deductible. That deductible could be 0. It could be quite a bit more than that, depending on your individual coverages that you need, the individual prescriptions that you have in conjunction and working with your doctor, et cetera. So we have the deductible stage. So typically you have to go through the deductible stage before you get into what they call the initial coverage stage. The initial coverage stage kicks in at the end of your deductible, whether it's 0, and I think the maximum deductible this year is $590 is the maximum deductible. So it could be anywhere from $0 to $590 per year, depending on the plan that you choose. At that point, initial coverage kicks in and you pay a copay for each drug you're taking when you pick it up from the pharmacy until that total retail cost of those drugs exceeds $2,000. And that's if those prescription is covered by the insurance formulary. So you have to be very, very careful on when you pick a plan, are the prescriptions you're taking, are they covered by that particular insurance company on their formulary? Each company has its own formulary. They categorize different medications at different levels and how that they pay. And there are many medications that are out there that are not on anybody's formulary. So you need to make sure you check that going forward. So we have our deductible stage, our initial coverage stage, and of course we have what we call our catastrophic stage. So once we hit that $2,000 per year of drugs that are on the formulary, once we've got to that retail cost, then your costs for the rest of the year go to zero for those drugs that are included on that company's formulary. So let's go over and describe our Part D process. The first thing that we do is we get you to give us a list of the medications you take, the name of the medication, the frequency of the medication, the dosage of the medication, and we put those into a program that basically is an online calculator that then goes out and starts to look at all the different plans that are out there, the different costs and different prices. We then will ask you to choose your pharmacy or what your preferred pharmacy is. A lot of the programs we use, we can actually select multiple pharmacies because what we're trying to do and we're attempting to do is compare all of the programs that are available in your zip code for the medications that you need to take, and also looking at different costs by pharmacy so we can figure out which program is the most advantageous to you, not only from cost, but also breadth and width of coverage to make sure the medications you're taking now and possibly any medications you may have to take in the future are going to be covered at a rate that's going to be affordable for you. The next thing we do is we actually walk you through the enrollment process. And here's what's really, really, really important is that once we go through the enrollment process, get you enrolled and get started on your plan, we want to reevaluate that every single year during our annual election period. So between October 15th and December 7th every year, we're going to want to get together with you, whether it be in person, through video conference, through phone call, and we're going to want to reevaluate your healthcare needs as it pertains to your prescription drug coverage. These plans change every year. Deductibles change every year. Companies enter the market. Companies leave the market. Companies have different formularies. They change their formularies. And so it's really, really, really important for you to sit down with somebody every year and reevaluate your prescription drug coverage to make sure you're not paying more than you absolutely have to, and you're not choosing a plan that's not covering the medications that maybe you've been taking for a few years. So just because you've had a medication from a plan this year doesn't mean that that same company is going to cover that same medication exactly the same next year. So you really owe it to yourself to make sure that you spend some time reevaluating this each and every year. So we mentioned penalties for Part D earlier, and we specifically talked about Part B penalty, right? Part D has a late enrollment penalty as well. It's an annualized up to 12%, which is 1% of the national base beneficiary premium. So a penalty for every month you could have had the coverage, but you elected not to enroll. So you would have your base premium, and then you would have to pay an additional amount for every month that you could have had insurance, but you chose not to. And this is a true penalty. This penalty does not go away. This penalty is going to live with you during the rest of your time with Medicare. It's not going to go away. So you're not going to have that problem because you're on this webinar today, and you're going to make sure that you're going to either choose a prescription drug plan during your initial enrollment of that 7 months around your birthday, or if you defer enrollment to when you finally do retire after the age of 65, you're going to have your 8-month window then after coverage ends, or you're going to choose an Advantage plan during that same time, and it's going to take care of your Part D late enrollment penalty. So nobody on this webinar should have that issue. Hopefully, if you're not 65 yet, if you're already past 65, if you're no longer working and you have not enrolled in Part D penalty, I suggest that you get a hold of a broker, somebody like ourselves or somebody else to help you walk through that process to make sure that you're going to be getting the coverages you need. And if there is no penalty, we can get those mitigated as quickly as possible so they don't continue. So just to recap real quick of Original Medicare. Original Medicare, you're going to have to pay Part B premium of a minimum of $185 a month, and it could be more depending on your income, up to as much as $628.90. It could be. A lot of people are going to be paying that Part B premium of $185. Some could be paying more for an income adjustment. You have your Medicare supplement on Original Medicare with a Plan G or a Plan N, whatever that might look like, or one of the other plans, and that does vary by zip code depending on what that's going to cost you exactly. And your prescription drug coverage is going to have varying plans, but they average somewhere around $15 to $30 a month. Some could pay less, some could pay quite a bit more, but that's going to be specifically depending on your individual needs, the area of the country, zip code you live in, what plans are available, and what combination of medications that you have to take. So those are the costs that are associated with Original Medicare. Where do we go from here? You started the first step today. You started some great Medicare education. Not only do we have seminars like this, but there's lots of other video content out there on the web that you can find from Medicare Advisors, whether it be through our YouTube channel or Facebook page, through retirementhelp.com, which is another website that we have that has lots of different parts and pieces and things that can help you from an educational standpoint. So once again, I appreciate you being here and starting the first step of your journey. The next thing would be that you could do is what we call phase 2, or when you're actually getting advice on enrollment, on how to walk through enrollment. You can schedule a free consultation to discuss your specific situation and get expert help, and you can choose which plans would be the right ones for you in the area and your life circumstances. And if you decided to take that next step today, here's a couple things that I'm happy to do for you. I'm happy to give you a couple of different bonuses if you were to follow through with the next couple items that you're going to see on your screen. The first one is we're going to complete for you, if you talk to us, whether in person, on phone, or by video conference, we're going to create a personalized Medicare roadmap that's going to give you step-by-step guide on exactly what you need to do next. And we wrap around that the different time frames, whether wrapped around your birthday or when you're going to retire. So you can see that graphically exactly what step it is you have to go to get yourself enrolled and get yourself ready and not incur any type of penalties. Another thing we're going to do on the second bonus is we are going to provide you with a Medicare cost summary, a detailed Medicare cost summary, where we're going to break down exactly what the cost of the supplement is going to be, exactly what the cost of the Medicare Advantage program is going to be, exactly what prescription drug coverage is going to be. We can tell you what those are going to be, going forward, and happy to write that down so you can see that once again in black and white and exactly what your cost would be. We've talked about some ranges of costs today, but we can get very, very specific if we were to have the opportunity to meet with you in the future. The last part is what we call lifetime support. There's one thing to get enrolled in Medicare, but as we mentioned earlier, specifically when I talked about prescription drug coverage, is that these plans, these parts change every year, right? The cost for the deductibles often change on a regular basis, premiums change, Medicare Advantage plans change as far as what they cover, prescription drug costs change, and so we want to make sure we're there for you after our time of helping you get enrolled. We want to give you lifetime support. We're going to help you with billing and claim service from our client services team, and we provide ourselves in checking in with you on a regular basis, help you get lost ID cards, checking in with your birthday, Christmases, making sure that you're part of our family. We don't want this to be a situation where we enroll you one time and we just never see you again. We want to help you navigate this system going forward. And as we age into retirement, our needs change. And so you need to have somebody who understands the processes and the systems and has the ability to walk you through that process with as least amount of trouble as possible. And we're going to make sure we do an annual review, once again at no cost, with a licensed agent every year to make sure that your plans that you need are matched to your specific needs year after year after year. So do this right now. Take the opportunity, schedule your free consultation to discuss your specific situation with us. Let's get an expert in front of you to help you choose which plans may be the right plans for you in your area and your life circumstances. During that meeting or that call, we're going to take the time to complete that personalized Medicare roadmap and that Medicare cost summary. So do yourself a favor and click on that gold telephone right now. Don't delay. And when you click on that phone, you're going to have an opportunity, if you would like, to schedule a time to meet with one of our advisors, whether me personally or somebody on my team will be able to sit down with you, answer your questions, complete these 2 specific bonus items for you, and start your way into that next step on your Medicare journey, full of confidence, knowing that you're going the right way. You don't have to take, like a lot of people that come into my office and they've made decisions in the past, and they just don't always feel confident that they have exactly what it is that they need. They know they picked a plan, but they don't know if they picked the right plan, the most cost-effective plan. Did they pick the plan that actually is going to meet their needs the best for their lifestyle, whether it's traveling or wherever that might be? So you will have that confidence. So once again, I really appreciate you taking that first step, becoming educated today. The next step is to click that golden telephone, schedule a call, get your free bonus items, and walk into this journey of Medicare full of confidence, knowing you're making the right choices that are best for you. Thank you very much. You have a fantastic day, and I hope we can talk to you soon.